Lateral view of larynx. It says the anterior wall is higher than the posterior wall. So inlet lies oblique. Thyroid cartilage placed slightly obliquely, and it is formed by the union of the lamina of the thyroid cartilage. Below it is a cricoid cartilage, and inferior cornu articulate to form the cricothyroid joint. Here epiglottis, superior thyroid tubercle, inferior thyroid tubercle, oblique line. Three muscles attached on the lateral surface of the lamina of the thyroid cartilage, and this lamina meets anteriorly to form the angle of the thyroid cartilage. Here ariepiglottic fold and one external muscle, that is the cricothyroid muscle, that extends from the lateral surface of the cricoid cartilage to the inferior border and inferior cornu of the thyroid cartilage. Three muscles attach on the posterior border of the thyroid cartilage, extending from the superior cornu to the inferior cornu. So here the cartilage that attached posteriorly to the angle of the thyroid epiglottis, thyroid cartilage, cricoid cartilage, posterior broad lamina, cricothyroid muscle, and the membrane anteriorly from the cricoid cartilage to the thyroid cartilage. It is a conus elasticus. Here there is an oblique line, three muscle, thyroid muscle, sternothyroid muscle, and thyropharyngeus muscle. The thyropharyngeus, it is a part of the inferior constrictor muscle. Three muscle, palatopharyngeus muscle, salpingopharyngeus muscle, and stylopharyngeus muscle. These all are the extrinsic muscle of the larynx. Here we are see the lateral view of the larynx. So here there is a lamina of the thyroid cartilage, inferiorly cricoid cartilage. Here we see the arytenoid cartilage. It has a medial surface, posterior surface, and anterolateral surface. From the anterolateral surface to the angle of the thyroid cartilage, there is a thyroarytenoid muscle, and posteriorly from the muscular process, it is a lateral cricoarytenoid and posterior cricoarytenoid. Here the epiglottis, from the thyroid to the epiglottis, thyroepiglottis muscle, and from the apex to the side of the epiglottis, ariepiglottis muscle. Here there is a conus elasticus. Apex of the arytenoid cartilage to the side of the epiglottis, ariepiglottis muscle. Here epiglottis cartilage, thyroid, cricoid, anteriorly narrow arch, posteriorly broad lamina. Here posterior surface of arytenoid cartilage. Here it is a thyroarytenoid muscle, thyroepiglottis muscle, ariepiglottic fold contain the ariepiglottic muscle. Here lateral cricoarytenoid muscle attached to the muscular process, posterior cricoarytenoid muscle, only abductor of the vocal cord attached posterior to the muscular process. So we can see here the posterior view of the larynx, posteriorly broad lamina. Above the lamina attached the arytenoid cartilage, and we can see the epiglottis from posterior view as it lies on the anterior aspect. Here posterior cricoarytenoid muscle from the muscular process to the lamina, between the two posterior interarytenoid muscle, and from the base to the apex there is oblique arytenoid muscle, and some fiber extend anteriorly to the side of the epiglottis, ariepiglottic muscle. cricoid cartilage, arytenoid cartilage, epiglottis, posterior cricoarytenoid muscle, only abductor of the vocal cord, muscular process, oblique arytenoid muscle, here in transverse arytenoid muscle, or it is also known as the interarytenoid muscle between the posterior surface, here oblique arytenoid from the one base to the opposite apex, and aryepiglottic muscle.